Pregnancy is one of the most remarkable journeys in life, but it can also bring hidden challenges. One of the most important, yet often misunderstood, is gestational diabetes. This condition doesn't just affect mothers during pregnancy, it can also have lasting effects on the baby and the entire family. In this video, we'll break down what gestational diabetes really is, why it develops, and what can be done to manage it. You're watching Wholesome Health, where we bring you clear, practical, and science-backed health information to help you and your loved ones live healthier lives. If you find this content valuable, don't forget to like this video and subscribe to our channel for more. Gestational diabetes is a type of diabetes that develops only during pregnancy. It usually appears between the 24th and 28th week and often disappears after delivery. The condition arises when the body cannot produce enough insulin to handle the extra demands of pregnancy. As a result, blood sugar levels rise. While it often resolves after childbirth, it should never be ignored. Gestational diabetes increases the chances of complications during pregnancy and delivery, and it also raises the risk of the mother developing type 2 diabetes later in life. Babies born to mothers with gestational diabetes may also face health risks, including higher chances of obesity and diabetes as they grow older. Stay with us until the end of this video, because the knowledge you gain today could protect both mothers and babies from avoidable risks. Now that we understand what gestational diabetes is, let's look at why it happens. During pregnancy, the placenta produces hormones that help the baby grow and develop. However, these same hormones can interfere with how insulin works in the mother's body. This effect is called insulin resistance. When the body can't make enough insulin to overcome this resistance, blood sugar levels rise and gestational diabetes develops. But not all women are equally at risk. Some factors increase the chances of developing gestational diabetes. These include being overweight or obese before pregnancy, having a family history of diabetes, being older than 25 years at the time of pregnancy, having had gestational diabetes in a previous pregnancy, belonging to certain ethnic backgrounds where diabetes is more common, and in some cases, even women without these risk factors can develop it, which is why screening is so important. One of the most concerning aspects of gestational diabetes is that it often develops silently. Many women do not experience noticeable symptoms, which makes regular prenatal checkups essential. However, in some cases, a woman may notice symptoms such as increased thirst, frequent urination, fatigue that feels more severe than normal pregnancy tiredness, blurred vision. Because these signs can be mistaken for normal pregnancy changes, doctors rely heavily on screening tests to detect the condition early. We'll discuss diagnosis shortly, but the key point here is this. Even if you feel perfectly fine, gestational diabetes can still be present. Since gestational diabetes often develops without obvious symptoms, diagnosis is usually done through routine screening during pregnancy. Most healthcare providers recommend testing between the 24th and 28th week, when the condition is most likely to appear. The most common test is the oral glucose tolerance test. In this test, a woman drinks a sugary solution, and blood sugar levels are measured over the next few hours. If the body cannot process the sugar effectively, it indicates gestational diabetes. This test is safe, quick, and highly effective. And it's a reminder of why regular prenatal visits are so important, because without them, gestational diabetes could go completely unnoticed until complications arise. Now let's talk about why this condition matters so much. For the mother, gestational diabetes increases the risk of high blood pressure and preeclampsia, which can be dangerous for both mother and child, a greater likelihood of needing a C-section delivery, a higher chance of developing type 2 diabetes later in life. For the baby, the effects can also be serious. High blood sugar in the mother passes to the baby, which can lead to macrosomia, a condition where the baby grows larger than normal. This can make delivery more difficult and increase the risk of birth injuries. Babies born to mothers with gestational diabetes are also at greater risk of low blood sugar shortly after birth, breathing difficulties, and later in life, a higher chance of obesity and type 2 diabetes. This is why gestational diabetes isn't something to brush aside. It's not just about the pregnancy, it's about the lifelong health of both mother and child. The good news is that gestational diabetes can be managed effectively with the right steps. The goal of treatment is simple: to keep blood sugar levels within a healthy range for both the mother and the baby. The first and most important step is lifestyle adjustment. A healthy, balanced diet is crucial. This means focusing on whole grains, fresh vegetables, fruits, lean proteins, and foods rich in fiber. Avoiding excessive sugar and processed foods makes a huge difference. Instead of large meals, eating smaller portions throughout the day helps keep blood sugar stable. Next, regular physical activity plays a vital role. Gentle exercises like walking, swimming, or prenatal yoga improve the body's ability to use insulin and reduce blood sugar levels. Of course, exercise plans should always be approved by a healthcare provider, especially during pregnancy. Sometimes lifestyle changes alone are not enough. In such cases, doctors may recommend insulin therapy or, in rare cases, certain oral medications. Insulin is safe during pregnancy and does not harm the baby. What's important is close monitoring. Regular blood sugar checks allow doctors and mothers to ensure that everything stays within safe limits. Another key part of treatment is regular medical follow-up. Prenatal appointments help track both the mother's and the baby's health. Sometimes, additional ultrasounds or tests may be needed to monitor the baby's growth. It's important to remember that managing gestational diabetes doesn't end with delivery. Women who have experienced it are at higher risk of developing type 2 diabetes later. This means adopting healthy eating habits, maintaining an active lifestyle, and keeping a healthy weight are not just pregnancy goals. They are lifelong commitments. And here's the inspiring part. With the right lifestyle, most women go on to have healthy pregnancies and healthy children. While not every case of gestational diabetes can be prevented, there are steps women can take to reduce their risk. Prevention begins even before pregnancy. Maintaining a healthy weight, eating a balanced diet, and staying physically active are powerful ways to lower the risk. For women who are planning to become pregnant, lifestyle changes such as cutting down on sugary foods, choosing whole grains, and exercising regularly can strengthen the body's ability to regulate blood sugar. Even small changes like walking daily or replacing processed snacks with fresh fruits can make a big difference. During pregnancy, consistent prenatal care is essential. Regular checkups allow doctors to catch gestational diabetes early before it causes complications. Monitoring weight gain, following medical advice on diet, and staying active are all part of prevention. Now let's talk about the long-term outlook. The majority of women with gestational diabetes deliver healthy babies and recover after pregnancy. However, both mother and child face increased risks later in life. Women who have had gestational diabetes are more likely to develop type 2 diabetes within 10 years. Children born from these pregnancies are also more likely to face obesity and diabetes as they grow older. But here's the hopeful truth. With consistent, healthy habits, these risks can be greatly reduced. Regular checkups, yearly blood sugar tests, and a long-term commitment to nutrition and physical activity can protect both the mother and her family's health for years to come. Gestational diabetes may be temporary, but its lessons should last a lifetime. Gestational diabetes is not just a medical condition, it's a reminder of how important it is to pay attention to our health, especially during pregnancy. The good news is that with awareness, lifestyle adjustments, and regular care, mothers can protect themselves and their babies from serious complications. Remember this: prevention and early action are always better than treatment. Whether you are planning for pregnancy, already expecting, or simply supporting a loved one, the knowledge you've gained today can make a difference that lasts for generations. Here at Wholesome Health, we believe that informed people make healthier choices. So if you found this video helpful, don't just keep it to yourself. Share it with someone who needs to hear this. And don't forget to subscribe to our channel, turn on the notification bell, and explore our other videos on pregnancy, diabetes, and overall wellness. Together, we can build healthier families and stronger communities. Stay informed, stay healthy, and remember, your health is your wealth.